Now, I'd like to introduce Dr. Aletha Maybank from the American Medical Association. Dr. Maybank is currently the Chief Health Equity Officer and Senior Vice President for the American Medical Association, where she focuses on embedding health equity across all the work of the AMA and leading the Center for Health Equity. She set precedents with groundbreaking work at the Office of Minority Health in the Suffolk County Department of Health Services while serving as the founding director. She has taught medical and public health students on topics such as health inequities, public health leadership and management, physician advocacy, and community organizing in health. She has a BA from Johns Hopkins University, an MD from Temple University School of Medicine, and an MPH from Columbia University Mailman School of Public Health. She's a pediatrician and preventative medicine public health physician. Now let's welcome Dr. Maybank with some virtual applause.
Thank you, Marcos, sorry about that. I'm going to share my screen. 1 second. Good morning, everyone. I hope everyone is doing well this morning. It's a beautiful morning. I'm here in New York City. It's a beautiful morning in New York City. And I know everyone, it's busy times for sure. I know everyone's continuing to work hard, but I do hope, this is my beginning message, that we all find the time and the hard work that we have been doing, but also in the months ahead and years ahead, to find the space for enjoyment and joy that I think we all absolutely deserve as a healthcare worker community, but as just human beings in general. So it's a real honor to be here with you all today at the Civic Health Conference. I really thank you for the invitation. And so I'm going to speak, I've created this title, Voting for Justice, Justice for Voting, just kind of a little bit arbitrarily, in the sense of, I just feel that there's such reciprocity in the space of voting and justice that often doesn't get elevated enough, as many of you experience in our places of work, in the spaces of healthcare, that need to be elevated a lot more. And I know lots of you have been using your voices over the last years, and especially this year, to say we need to do more as a physician healthcare community. And I just say that I recognize that work, the reward of it, but also the struggle of it at times as well. And so a lot of my conversation today is going to be around more so kind of my experience, at an institution, and what does it mean, and the work of being at an institution to really advocate for physicians and healthcare workers to be even able to talk about voting and advocate for voting for our communities and amongst us as well. So I start with a land and labor acknowledgement, that we acknowledge that we are all living off of the stolen ancestral lands of Indigenous peoples for 1,000 years. We acknowledge the extraction of brilliance, energy, and life for labor forced upon people of African descent for more than 400 years. And we celebrate the resilience and strength that all Indigenous people and descendants of Africa have shown in this country and worldwide. And we carry our ancestors in us, and we are continually called to do better as we lead this work. So I'm going to start, with a personal story. On the left-hand side is my mother and myself. It's one of my favorite pictures of my mother and myself. She is now 86 years old. And this picture, I have no idea how old she is. I could do the calculation, but I was in kindergarten, I was graduating. On the right-hand side is a picture that I actually found through Ancestry.com, of all people, of all places rather, that holds records. And my context to voting actually very much is connected to my mother and the fact that she's not from this country. And the piece of paper on the right-hand side is the paper that actually was the paper that was submitted, the formal document of the day that she arrived in this country in 1962. And she has always impressed upon me in terms of the reasons of why she came to this country. And many folks who have family that are not from this country, or parents from this country, hear it pretty consistently of the opportunity and the experience to be able to do more than she was going to be able to do in the country of her birth. And then she also talks a lot about, then for me, kind of the rights behind all of that and the opportunities that are here, and not to take them for granted. And she would say this to me quite often, especially as it related to voting. And to the point of, one year, this is the 2014 November election, she sent me this text. It's kind of really perfect description of how our relationship goes. And I'm not trying to be partisan, but it's clear where she sits. But telling me it's great weather for voting. Her former boss, she was very much in government, as I was at one point in time as well, praying for the miracle, but she hopes that I exercised my right to vote. And imagine getting this like every single election. And so my commitment to voting very much is rooted in this context of my mother and my experience with her, but her experience from not being born in this country and really understanding the opportunity, the value, and the privilege and the right to be able to vote. And I carry that with me as I do the work that I do. And so I also think a large part of like my context to appreciating voting and understanding its impacts rests in also my educational background in public health, not as much in medicine, but my background in public health. And public health, very much provides a larger kind of framework. We know medicine is kind of moving in this direction, but public health is what provides that larger framework of what creates health. And so that shifted my lens a long time ago to really understand and question beyond what was happening in the doctor's office and the physician's office of all these things that were important to creating health for people in this country. And really understanding that the left side of this space on this particular picture, the structures and the structural drivers, the laws and the policies were absolutely critical to how health was set up in this country. And if that's the case, then the people that we were putting in office were absolutely critical for how health was set up in this country. And for that matter, then our democracy and the ability to be able to vote is absolutely critical for our ability to sustain health. Can you hear me now? I saw I was muted. I'm muted again, it says.
We can hear you.
You can hear me?
You're all set. Yep.
Okay, thank you. Other just personal influencers, and one on the left-hand side, I see my dear friend, Dr. Manisha Sharma, who is going to be speaking a little bit later, but I learned more so the context of what a physician can do around voting, as well as organizing within their institution and the impacts on physicians and patients from these individuals on this slide. I bring this up because I don't feel that we do things oftentimes independently. We do things dependently, we are inspired by others, and we are often working in solidarity with others. And I think that's always critical to elevate as we do this work, and especially in institutions that can be large, long-standing, in which you can feel sometimes and oftentimes isolated in doing this work. And so I elevate Dr. Manisha Sharma, I elevate Dr. Bill Jordan, who actually was at the health department with me and now is at the AMA with me, and then Dr. Mary Bassett, who many people are familiar with, who I've learned a tremendous amount of courage, but also, the ability to kind of say, well, why can't we do it? Why can't we have and set up voting from our neighborhood health action centers and set up registration and encourage people to vote? We're a government institution. Why can't we do it? And so really learned a lot about, building that sense of courage that it is okay for us to show up as physicians in this space. And this is not new, as many of you all know. We have a legacy of physicians and healthcare workers who have supported voting rights and civil rights. They're on the left-hand side, and this is pictures who participated in the Freedom Summer during the civil rights era of the 60s, and they were registering people to vote. And then the two doctors, and many are familiar with the two doctors on the right-hand side, or the one doctor, Dr. Krieger, and then Gibson as well, who was a community organizer in the community health center movement at the Delta Health Center in Mississippi. And their initial efforts always were inclusive of voter registration within their activities. And so I think it's really important to call upon, our history as physicians in leading this work and really encouraging voter, increasing civic participation, because we know what the data shows, we know what the evidence shows for a long period of time at this point. And then we also have to be honest, and I have to be honest and transparent about our own history as institutions. I mentioned the importance of understanding our history is central, but it's also important to know where we were and kind of where we were not as an entire physician body. And while not explicitly talking about voting in this example, but there are the intersections, the role that medicine played in the civil rights movement was really largely outside of the institution that I work for, of the AMA. And civil rights was almost actually completely unmentioned when we look back at our AMA records. And the AMA is known to have ignored and even obstructed the civil rights agenda. And so it's important, and I think we experience this today, to recognize the opportunity of physicians and that we keep critical focus on that in terms of our ability to advocate for justice, to advocate for voting, but also recognize the impacts of institutions that have also tried to block that. And on the right-hand side is actually the same committee before the Medical Committee for Civil Rights that picketed for inaction on the part of the AMA across 4 years in 1963, 65, 66, and 68 on major issues as it related to especially desegregation of hospitals. And this is a point for me that I tend to use, and I bring this up because I tend to use this because I will get narratives or phrases and sayings, that we aren't to be in these spaces of advocacy, organizing, and politics, as well as voting. And I said, at the end of the day, the reality is that AMA physicians and the physicians that were in the previous slide all recognize that keenly recognize and are aware of the power of politics in our democracy and the importance of physicians in these environments. It's not new, but there are all these narratives that oftentimes are put forward that have, especially young students, I feel, thinking that we are not supposed to be in this space. And I feel a lot of our work is to disrupt that. So thankfully, physicians and med students have continued this legacy and accountability. There are many examples clearly here with this conversation of Vot-ER, AMSA, the Civic Health Alliance, formerly Vote 2020, that we engaged with before as well. And I'd say the AMA began in 2020 to really start using its platform to elevate the physician's role in voting. And again, thanks to Vote Health 2020, which is now Civic Health Alliance, and to the leadership of Manisa Sharma and Stella Sappho, who approached me at the Center for Health Equity, asking, what are you all doing around voting? This is an equity issue. It's a full health issue. How are you all going to show up? And so this is actually even before we had any policy. And thankfully, there was definite openness and a recognition and an awareness of some of the evidence on the part of the leaders within AMA that we were able to kind of use our voice and to elevate, have some conversations through our Prioritizing Equity series and our daily, what we call a COVID update, on elevating this role. And it was interesting of the feedback that we received, folks very grateful, and at the same time, folks also sometimes confused among the physician community of why are we doing this? Why are we in this space? And then it led to kind of a reality and a larger conversation that there needs to be policy, that's set and put in place at the institutional level in order to really solidify the opportunity for AMA to be in this space. Now, I can't particularly guide, or ignite that policy per se, or provide those sparks for it to happen. But this really is a lot of the work of the House of Delegates and the members there as well. The other thing that we launched kind of in the meantime to kind of set the stage per se, strategically, and to really start putting forward this opportunity for AMA to have, fellowships and physicians within AMA engaged in politics more explicitly. We launched a Medical Justice and Advocacy Fellowship with the Morehouse School of Medicine, the Satcher Health Leadership Institute. You all, I think, heard from Daniel yesterday, or you're hearing from him tomorrow, but he's a keen partner and he's a very good friend of mine as well. And we launched this program to also just put forward this narrative and begin to solidify AMA's space and place in saying, the political determinants of health are absolutely true. They do exist. And voting is a context to that, advocacy is a context to that, and our physicians need to know about it in order to impact health and equity across this country. And so, there's one day I always say I'm going to write a book called From the Inside, because there are things that you can't share. And we all experience this. Part of our work and being able to create change and justice and change in general, whether you're for justice or not justice, is about how well we can do the internal and external organizing to push forward the ideas and the knowledge that we know is true and that should be happening and should be in place. And so there was a lot of, there were conversations that were happening from the external environment into the internal environment of AMA to figure out how best, we're going to put this policy forward as the AMA and have it passed. And thanks to the Minority Affairs section and the National Medical Association, which also has a delicate seat within the AMA, this resolution was passed. And it was pretty leading for, an institution like the AMA to do something of this nature and I understand the influence that it has for the larger context of medicine, but basically resolving that the AMA acknowledges voting as a social determinant of health and significantly contributes to the analysis of social determinants as a key metric. We recognize that gerrymandering, which disenfranchises individuals and communities, limits access to healthcare, including but not limited to the expansion of comprehensive medical insurance coverage, and negatively impacts health outcomes, and that the AMA has to collaborate with appropriate stakeholders and provide resources to firmly establish a relationship between voter participation and health outcomes. And that's part of the engagement that we were having formally now with Vot-ER at this point in time. And we're going to do some obvious opportunities that will help elevate the work of Vot-ER and other organizations that are also supporting voting and making sure that our physicians understand the importance of promoting voting for themselves, amongst themselves, and amongst healthcare workers, as well as for their patients. The other opportunity that happened this past meeting in June, when that policy was passed, there were several other policies that were passed as well. Oftentimes, and we all understand the power of the young people within the medical community, the medical student section, the young physician section, and the resident fellow section, and the minorities affairs section. They also passed policies related to support for safe and equitable access to voting. I already mentioned voting as a social determinant. They passed a resolution on support for democracy, as well as another resolution on the medical community voting in federal and state elections, just to ensure that there's a wraparound to the policy, the initial policy, and some teeth in it as well. But again, I just speak to one, the value of the young voices and the organizing that they've been doing and the courage that they have to put these types of policies and resolutions forward, and the kind of partnership and collaboration it takes within an institution in order to drive these opportunities so that the voting goes in the directions that we all need and want them to go. But as many of us know, there is ever-present pushback. There are dominant narratives that we are always having to overcome. Mentioning some, physicians' role isn't about politics. Physicians have enough to do, so why are we asking them to do more? What's the evidence? And oftentimes that, to me, is one of those kind of trick questions, because really they're assuming and they're making assumptions that they're just being kind of opinions that are being put forward as it relates to voting, or this is not a priority. And on the right-hand side is just one of the more recent articles that has been put forward. It's kind of all over social media in many different ways, a lot of activity, referring to doctors who are working in the context of social justice as, woke doctors. And so the article says the nation's leading group of doctors goes full woke in pursuit of improving health. And I guess we were half woke at some point in time when the strategic plan was released. I guess we got half woke and now we're full woke. But this is becoming pretty consistent as a response to the work that many of us are doing at these institutions. And I know Dr. Skorton is on the panel next, and he's going to be able to speak, I'm sure, some of his experience also that he's had. And so these dominant narratives, that exist, I think this is part of the work, not only as kind of the organizing, the solidarity, the partnership that has to happen within institutions, along with external to institutions to drive change, but we have to work on how do we understand these narratives that keep coming up within our institutions and within the space of medicine that disrupt our ability oftentimes to easily do what we know the evidence is showing that we should be doing. And so we have to find that opportunity of how we understand dominant narratives and how do we disrupt them. And so to that end, in partnership with AAMC, and we're very thankful for the partnership with AAMC on this and their team at the Center for Health Justice, we launched a guide, a language guide, language, narrative, and concepts to help support physicians and healthcare workers and anybody else, because a lot of folks have taken this up even beyond medicine and healthcare, to recognize, the limits and the consequences of language, that's used and why these dominant narratives can be problematic. And then what we're going to work on is also soon, how do we work on and help teach skills on how do you disrupt them? And so my call to action in all this work, I'm sorry, again, keep going the wrong direction. My call to action in all of this for us is to continually to recognize, challenge, and disrupt dominant and malignant narratives that serve to really undermine voting and equity even more broadly. This is the area that I know, actually, sometimes I think when I think about myself, having to do this over and over is actually quite exhausting, truthfully. And I think the more that we're able to, again, work in solidarity, find other champions, find other colleagues and co-conspirators in this space, the easier it is for us to do. To do it alone is really challenging. However, I do feel it's really important that we have the ability to challenge these narratives, know the evidence, or at least know where to find it, because you will be challenged consistently on that. Again, work in partnership and solidarity with others to hold your institutions accountable. And remember that you are always standing on the shoulders of those who came before us. We are part of a freedom fighter legacy that also harbored determination for both self and the collective, fear, belief, hope, and of course, love for themselves and for all people. And so just kind of to close out, again, recognizing the shoulders that I stand on, I had the beautiful opportunity and privilege to meet Representative John Lewis shortly before he passed, actually, when I first started this job at AMA. And anybody who's met him knows that he's gracious in every moment that he has of his life and what he gives to you and what he says to you. But his words will always ring true. And I think a lot of what we're doing right now for me is in his memory and his legacy and all that he's brought forward. And then there's James Baldwin. Since we live in an age in which silence is not only criminal, but suicidal, I've been making as much noise as I can. And I used to stop the quote actually right there. And then I was doing some research and I was doing a keynote on the Holocaust and its lessons learned from racism in the United States, and really was exposed to the larger quote, which I actually think is really important in the sense of here in Europe, because he was in Europe at that time, on radio and television, in fact, have just returned from a land, Germany, which is made notorious by a silent majority and not so very long ago. And I also I picked this particular picture because of his smile. We tend to, like when we're on serious topics, we get serious faces. But I love James Baldwin's smile. And this is, again, something that's kind of really resonant for me this particular year. And one of the most profound statements someone has said to me this year was, Aletha, remember, your ancestors were not only fighting for your freedom and liberation, but they were also fighting for your joy. And so this picture and the smile and our ability to be able to do that, I think, is absolutely critical in this moment. We're not just fighting, we're fighting for our ability and everyone's ability to be able to experience joy in life to its optimal and to its fullest. And I end with Ida B because I love Ida B. I have never met Ida B. Wells. I could not find a picture of her smiling. This is as close as it gets, but she did a lot of work, and I know she had to be very exhausted. But in this exhaustion, and we know we do have a lot of work ahead. Again, I just want us to remember and recognize all those who came before us. It is what gives me hope to be able to move forward and do this work every single day, whether it's at the American Medical Association, or anywhere else that I'm organizing. But just remember those whose shoulders we're standing on. And these are many of the women who help support advocating for rights of women, but especially around the context of voting, and at all the intersection of race and ethnicity across this country. Thank you.